Good afternoon. My name is Dr. Joel Rosenbloom. I'm an assistant professor teaching stream at the University of Toronto, Faculty of Dentistry, and a staff dentist at CAMH. I'm also an adjunct assistant professor at Addis Ababa University in Ethiopia. Today, I'm going to talk about a severe oral infection called Noma. I first encountered Noma in Mozambique in 1987 when I was working there as a dentist. Noma is caused by a mixture of bacteria and is aggressive and has a mortality rate of over 90%. It starts in the mouth and can spread as rapidly as 8 days to the outside of the face, destroying all the tissues along the way, either causing death or lifelong disfigurement. It has a mortality rate of over 90%, as I previously said. It largely affects young children under 5, mostly in sub-Saharan Africa, but is also found in Laos and South America. First of all, Noma is a disease of poverty, and it's 100% preventable. The conditions that set the stage for Noma are poor oral hygiene, malnourishment, and systemic illness, usually measles or malaria. The first time I saw a young patient with Noma, it affected me deeply, leading to a sense of outrage. How can we accept that a disease of poverty that's entirely preventable can take the lives of over 100,000 children a year? To me, this is not acceptable. I have seen other children with Noma since this first encounter, and I continue to believe that it is not okay to allow Noma to exist. We should not accept this, and as a society, we need to commit to the eradication of this horrid condition. I've been actively working to raise awareness about Noma over the past 8 months, and in particular, I've been involved in lobbying efforts to the WHO to include this disease in its list of neglected tropical diseases, otherwise known as NTDs. This would focus more resources towards prevention, research, and treatment of Noma. I'm also collaborating with Claire Janté, a French filmmaker, to show her recent film called Restoring Dignity, a journey with Noma survivors. We have a virtual screening scheduled for this month on January 20th at 6 p.m. If you're interested in linking to it, you can contact me at the University of Toronto Faculty of Dentistry. I would like to end by quoting the famous Swiss physician, psychiatrist, and explorer Bertrand Piccard. When we first hear its name, we do not know what it is. When we hear what it consists of, we cannot believe it. But once we see the devastation wrought by the disease with our own eyes, we will never be the same again. I could easily have written that in 1987 when I looked into the eyes of that child in Mozambique with Noma. Thank you very much for listening.